Hello, my name is Dr. Nga, and in this short video, I'm going to share with you some of the study tips that I have learned myself over the years. I'm a pathologist at the Department of Pathology in the National University Hospital as well as National University of Singapore. Basically, these have helped me through 10 years of studying, 5 years through medical school, as well as 5 years of postgraduate training to be a pathologist. So I'll start off with this interesting quote that I found, which you can read for yourself. Unfortunate or fortunate but true, clearing exams really does require hard work. Now, what do you need to know just to put some things into perspective? Of course, unfortunately, there is really no shortcut. It does require a lot of hard work and concentration. Do study for the right reasons. This will help you in the middle of the night when you're pulling your hair out. It will help you to keep things in perspective. And of course, the studying tips that are some practical use, hopefully, I will share with you. So there is no shortcut. Knowledge is required. If you don't know clinical signs and symptoms of a disease in medicine, you really won't know what history to take from the patient, how to investigate and how to examine the patient, and what tests to order, and also you won't be able to come up with the right diagnosis, at least not in the first instance. Therefore, the patient won't get the right treatment initially and won't get better. So it is hard work, but it is absolutely worth the effort. It is enormously satisfying when you start to treat your own patients to be able to come up with the correct diagnosis, order the right targeted investigations, and provide the right treatment. Study for the right reasons. What do we study for? So medicine is really a profession that aims to relieve others' suffering and pain. Simple and obvious as it sounds, sometimes it helps to remind yourselves of that. It always starts as well as ends with the patient, and everything that you study relates to the kind of doctor you'll be. So what we hope to achieve as medical teachers is to produce cohorts of safe as well as competent doctors every year so that they will be able to alleviate patients' suffering. Okay, now it comes to the practical parts. What are some of the studying tips that I can share with you? Well, the first tip is always keep in mind the big picture before you zoom into details. When you are starting to read, whether it is your textbook or your lecture notes or even your senior's notes, start with a very low power lens first, and then you can progressively zoom into more detail. Try to resist memorizing disjointed bits and pieces. This helps you to keep everything in perspective. Now, if you don't understand the big picture, the details will always be floating disembodied facts that you can't really link together, and it's much harder to remember things this way. So a useful technique is to write your own mind maps or draw your own mind maps. These will help you to see how different parts of a topic interconnect with each other. And you'll find that in any topic, for example, in cardiovascular system, just a systemic topic, there will be lots of links between different disease entities, and this helps you to remember better. So draw your own mind map and summarize each topic into a single large mind map at the end of your studying period. The second tip is to ask questions even before you start. For example, if you're dealing with a general pathology topic such as inflammation, which can appear to be extremely factual and abstract, always ask yourself a few questions first. What is the definition of this condition? If you don't know the definition, you'll be on a weaker starting point. So define, and then ask, how does this arise and why does this arise? So essentially, what is the pathogenesis? And this is not just for pathology. This is a very useful approach for any subject in medicine that you're studying. So why does the disease occur and how does it happen? And then you want to ask yourself, what is the appearance or the face of the disease? So what are the gross and cellular morphologic features of the tissue? Now, morphology helps you because it gives the process or the condition a face. It helps you to appreciate the disease process because you actually know what it does to individual cells and therefore tissues, and it also helps you to extrapolate the clinical picture in the actual patient. Also, gross pathology correlates very well with radiology or imaging findings, which is what we do in real life to look at the disease. And then we want to ask very practical questions like what are the clinical manifestations, of course, as well as the sequelae or complications of the disease. The next tip is to classify. Always classify what you are learning, starting from a very broad base and then branching out. So why do you want to classify? Because it makes memorizing easier. There are fewer loose facts that are floating around. Everything becomes better connected. It also helps you keep the big picture in mind, and it makes it less likely for you to leave out important things. So how do you classify? Again, mind maps are a very important and useful tool. And you can also use this mnemonic vitamin C and D, which is helpful in remembering the main disease categories. Here is a screenshot of the mind map in the video below, looking at studying tips. So you can see that with one page, it sort of just summarizes all the important points: why study, knowledge for diagnosis, for treatment, some of the tips, big picture using mind map, and asking questions, especially for system-based topics. And then here we have the disease classification. Now, let's look at vitamin C and D. So this is a helpful mnemonic to organize diseases, specific diseases, into major disease categories, which can pretty much be applied across all the systems in the body. So let's look at the letters one by one. V stands for vascular diseases, I stands for infectious conditions, T is traumatic, A is for autoimmune, M is for metabolic, I is for iatrogenic, so caused by medical treatment, or idiopathic, not knowing what the cause is, and N is for neoplastic, of course, and C, congenital, and also including genetic, and then D is degenerative. So I've come to the end of the studying tips section. So just to summarize, study for the right reasons. It helps you through the night. Look at the big picture first and then progressively branch in, and ask yourself questions before you even start so that you can answer them actively along the way. So this makes studying a more active process. Classify and organize. This takes a little bit more effort and brain power, but it is well worth it. And a very useful tool is to draw your own mind maps. Education is what remains after one has forgotten what one has learned in school. So don't forget to pick up important lessons along the way. While your main aim may be to pick up skills and knowledge, you will certainly meet a lot of good mentors, and do pay attention to other important life lessons as well. So happy learning.